welcome back. If this is your first time, welcome. My name is Ifenwa Omesiete and I am a pediatric nutritionist. What that means is that I provide clinical and non-clinical support for parents through nutrition to ensure that their children live a healthy, long, and fulfilling life. Now, in today's video, we're going to be talking about adenoids. Now, if you're wondering what does adenoids have to do with nutrition, stay with me because it has a huge impact as to why a lot of you have picky eaters, constant colds, coughs, and so much more. So without further ado, let's get right into it.
Your love is rated X. That means you're extraordinary.
Okay, so let's relax and talk about this. Now, adenoids are part of your immune system. Yes, they're actually part of your immune system. They are soft lymphatic tissues. I'm gonna try not to get too technical here, but they are soft lymphatic tissues. So a lymphatic tissue is part of your lymphatic system, which helps support your immune system, okay? So they are soft tissues that are found at the back of your throat. Now here's something interesting. They are found in what is called a nasopharynx location. So what that means is between your throat and your nose, there is where you're going to find your adenoid. Now, this is really key to note because most of the time when people complain about colds and coughs and all these things, it affects those two systems, right? So your throat and your nose. And guess where the adenoid is? Right at the back in between. Now, I mentioned that they're part of the immune system, and the reason for that is because they actually support in helping fight infections and colds and coughs and bacteria and viruses and all of that wonderful stuff, okay? Now, they're also very close in relationship with what we call your tonsils. Now, your tonsils are also at the back of your throat, but you have two, and they're located around this region right here. So you have your adenoids at the back, and then you have your tonsils right here. Now, of course, whenever you take your child to the hospital, or you're having a conversation with maybe your doctor on the phone and you're concerned that your child is running a fever or they have a cold or something, they usually would ask your child to open their mouth and then they will lower their tongue and put a torchlight at the back. Guess what they're looking at? They're looking at the tonsils and they're looking at the adenoids, okay? So now that we know what adenoids are and we know that they're part of the immune system, let's actually talk about what their major job is. Their major job is that they help in supporting your tonsils in the production of what we call T cells and B cells. Now, I teach a course that talks about the different aspects of the immune system and all those beautiful things, but we're just going to focus on what the adenoids do today, okay? So the adenoids, they help the tonsils in the production of these T cells and B cells. Now, T cells and B cells are not made in your adenoids, okay? They just help in the production of them. And these are key in helping your child fight infections and diseases, okay? Now, why do we always think adenoids are bad? I'm going to get into that. But before I talk about why I'm having this discussion and why we need to know what adenoids are, I want you to fully understand that anything that affects your throat, anything that affects your nose is definitely going to affect your appetite. It's in the same place. Food goes through your mouth and you have to swallow it through your throat. Anything that comes from your nose is going down your throat as well. So you see how this is so important for nutrition because that's also the same pathway where your nutrients are going to pass through, food is going to pass through. So you can see how difficult this would be for a child who, for example, has like a cold or a cough. It's just uncomfortable, really. And why am I talking about this? Because I've noticed a lot of people have these issues with their children and have not been able to put the two together, okay? So let's talk about why adenoids are seen as a bad thing. Adenoids are only seen as a bad thing when you have what is called adenoiditis or inflamed adenoids, or you have enlarged adenoids. So now let's talk about enlarged adenoids first. Enlarged adenoids simply means that your adenoids are usually bigger than the average size. Now, why is this important? Because if your adenoids are bigger than the regular size, it means that you're more prone to getting infections, whether it's bacterial or viral. Now, let's talk a little about the history of adenoids. They usually exist from about 7 months of gestation to about 5 years. After the age of 5 and 6, your child's adenoids sort of become like fatty tissue that just becomes part of their body. So it's done its job by helping with the production of P cells and T cells, and then moves on to other aspects of your body. Now, within the first 6 or 5 years of life, it's really important to know if your adenoids are enlarged, because that could be the singular reason why your child has a repeated coughs and colds and infections and sleepless nights and struggles with eating, right? So that's basically the lifespan of adenoids. Now, I was talking about enlarged adenoids. Now, imagine a situation where your child has enlarged adenoids. As I mentioned, it is responsible in most cases for the frequent colds and coughs. Now, inflamed adenoids, as the name implies, simply just means that, hey, I'm gonna be exposed to bacteria and viruses, and you're gonna have to treat me, okay? So that's essentially what inflamed adenoids means. Now, symptoms of inflamed adenoids. Ear infections, yes. Sleep apnea, I'll talk about what that means. And then of course, the dreaded cold and cough, frequency of it. So let's talk about ear infections. There's a tube that goes from your ear down to your throat, and fluid passes through that tube. Now what happens is if you have enlarged adenoids or inflamed adenoids, there's a blockage. So the fluid is not able to go down your throat anymore. And when that fluid is stopped, it's more susceptible to infections, especially bacterial or viral. And you know how terrible ear infections can be for children. You're talking about fevers, you're talking about antibiotics, you're talking about coughs, the list is endless, sometimes even eardrops, right? So these are one of the symptoms that can tell you that especially if it's frequent. 1 or 2 ear infections in like 6 months or a year, not too bad. But when you have it so frequently, I'm talking about like every 2 to 3 months, you might want to have the doctor look at your child's adenoids, okay? Now, if you notice that when your child sleeps, they're struggling to breathe, maybe they're snoring, or you notice that they keep their mouth open while they sleep because they can't seem to breathe through their nose, that's a sign that the adenoid is so large that it's blocking the airway, especially when you're lying down, okay? And that's a sign to show you that they're struggling to breathe. Now, that's one side of it. Another side is what they call sleep apnea. Sleep apnea actually means that your child dies for a little bit. I know, it sounds scary, I'm sorry, but that's basically what it is. So they stop breathing for a period of time. And this can mean that there's loss of oxygen to the brain. So if you notice this happening frequently with your child, head to the hospital, let them check whether your child has enlarged adenoids, okay? Another aspect of it that I mentioned was loss of appetite. Now this is the part that I come in. Over the years of seeing different patients and examining parents who complain about frequent coughing, catarrh and the likes, I always ask if they have frequent inflamed tonsils. If you remember at the beginning, I mentioned that the tonsils and the adenoids are sort of in the same area. Now, if this seems to happen very frequently for your child, you might want to ask the doctors to tell you if your child's adenoids are enlarged or larger than the average size, okay? Because this is important, because imagine a situation where you have enlarged adenoids and you're trying to feed this child. First of all, they're struggling to breathe. Second of all, they're always disturbed by this thing that seems to be itching or blocking or, it's just uncomfortable. I don't want spoon, cereal, anything that would seem to cause difficulty in swallowing. That's why you notice a lot of children who have frequent colds and coughs usually prefer purees or smooth solids. Keep this in mind. I've seen a lot of patients who experience this, and usually it's because the children's, especially if there's an association of the child preferring only liquids, refusing to swallow, pretending as if they're gagging, even after they've gone past like age 2. that's a sign that you definitely want to take the child to the hospital and have their adenoids examined, okay? Like I said, there's a lot of intertwine between your immune system, and adenoids they're just in the wrong place, honestly. They're in one place that is obstructing the nose, the ears, the throat. Whew, sometimes I feel for these kids, okay? So now that I've explained that, when you look at your child's frequent colds and coughs, you look at your child's sleeping habits, you look at what maybe, in fact, in some cases, it's when you took your child to creche that you then began to realize that, oh, they seem to be having back-to-back infections. And you haven't gone to the hospital, you're just self-medicating with antibiotics, or you're going to the hospital, and every single time you go to the hospital, they give you antibiotics. It's time you ask this question: could my child's adenoids be enlarged? Okay? Now, let's step away from the symptoms. Now imagine a situation where, okay, Ify, I've identified that my child has enlarged adenoids. What do I do? Because it's affecting their appetite, it's affecting their sleep. This is like our 6th bottle of antibiotics this year, and I'm tired. 2 things. You need to get a test done. Adenoids are not just done by pulling down the tongue, examining, no. That could be a preamble, right? You still want to get a test done. And the test that could be done is you could either do a CT scan, or you could do an endoscopy. An endoscopy is basically putting a long tube that has a camera and a light down your child's throat. Uncomfortable, I know. But it helps to examine to see if the adenoids are larger than usual or constantly inflamed. The CT scan is a bit less invasive, but it would still allow you to see, allow the doctor to be able to see, okay, this is the situation. And when you get that diagnosis, there are 2 ways to handle it. 1, surgery, dependent on the size and the level of health problems it's causing. Because like I said, sleep apnea is not something you want for your 2-year-old, okay? Shortage of oxygen to a brain that is still developing frequently through the night is not ideal. Snoring, they're too young, okay? Frequent use of antibiotics. Antibiotics are not honey or syrup or, strawberries we're licking here. It's medication, and every single medication has a side effect. So you don't want this to frequently keep happening for your child. So there is surgery. Now surgery sounds like a huge thing, but in children, especially at the younger ages, it has less side effects and they usually come out pretty fine, okay? But your doctor will determine if your child needs surgery or not. The other aspect is to keep managing it by taking medication. Now this is the part that I have concerns about. If your child constantly has a fever, constantly on antibiotics, constantly on cough medication, it gets exhausting for the child, and it's going to keep affecting their appetite. So when you come to me and you're saying, hey, can you help me sort out my child's diet? They're struggling to eat. I don't know why they only like purees. It's been 2 years, it's been 3 years. I'm gonna go through a series of questions with you, and if I find out at some point during a consultation that your child has enlarged adenoids or potentially could have enlarged adenoids that are making it difficult to swallow, I'm going to send you back to the hospital to get an examination done. Because you're just making life difficult for this child, okay? Now, does this mean that every single cold and cough is an adenoid? Definitely not. It's not enlarged adenoids. Like I said, adenoids are not the bad guys. The ones that are big and get frequently infected are. But on a regular day, so many children every human being has an adenoid. As long as you're a child within the ages of 0 to 5 years, you're gonna have one. Now, depending on whether yours is enlarged or not, will determine whether you're gonna go through this whole video and this whole cycle that I've just mentioned. So, I hope this has been helpful. I didn't want this to be too long. I wanted to get all the points out and for you to start making a more informed decision. Because like I said, a lot of the issues that we have when it comes to your child's nutritional health, especially when I hear parents say, oh, give me an immunity syrup. It's not a function of immunity syrup. Immunity syrup is not going to reduce the size of an enlarged adenoid. Oh, Ify, I need medication. Can you tell me what fruits they should be taking? I can tell you all the fruits in the world. But if your child has enlarged adenoids and surgery is required, that might be the direction we're going in. Now, there are, of course, ways to pacify not getting surgery, because not everybody wants to do that, and that's okay. I completely understand that. But what I do want to mention is, think of your child, right? Surgery is not the only route. Like I said, there's medication that your child can be on until they outgrow it, because like I said, after the ages of 5 and 6, your child's adenoids become soft tissue, fatty tissue that the body just uses up. Now, if your child doesn't outgrow it by that age, you might want to have the conversation again with your medical practitioner, okay? Thank you so much for watching this video. I hope this has been helpful. And if you got to the end of this video, I have a gift for you. Yay! I love giving gifts. Send a message on Instagram. This is my Instagram handle. And say, hey Iffy, I got to the end of this video and I want to get the Immunity Boot Camp. You're gonna get a whooping 20% off just by getting to the end of this video. All right? I hope this has been helpful. Again, my name is Ifenwa Omesiete, and I will see you in my next video. Make sure you subscribe. Don't forget to subscribe. Look for the button somewhere and subscribe. All right, see you. Bye.